मैं देख ले रही हूँ।
Good morning to all respected dignitaries. Just now I called Khanna ma'am. She'll join, it seems. Soon after joining, we will start the session.
She joined us. Sir, she has joined.
Good morning, ma'am.
Good morning to everyone. I was trying on that. Then finally, I have to call my son. He put me on. I don't know what did I do wrong. I saw Raman. Well, the presenter is here.
Yes, ma'am.
And oh, Dr. Indra
Morning.
Moza from Srinagar, Kashmir.
Good morning, everyone. Good morning, ma'am.
Good morning. Good morning.
Our chief guest is here too. Rita ji,
Yes.
good morning.
Good morning. ma'am.
Good morning.
And where is our Asha ji and other?
Ma'am, just now I called Asya ma'am. She's not picking. I don't know. I called her just now.
Okay, I will try, but you can start if it is a time.
Okay, ma'am. Just once try, ma'am. I'll start it.
I'm going to call her.
Yes, ma'am.
तुमने नहीं हटना.
I hope she is not on the plane. She was trying to go back to India. I forgot the date.
Yes, ma'am. Just I called, but ring was there. I don't know.
Ringing, but nobody answering.
Yes, ma'am. Yes, ma'am.
Where is Binu, sir?
Venu sir is there, ma'am.
Okay.
Yes, madam, here only. Good morning.
Good morning, sir. I'm glad at least. I was asking in the meantime, Sandeep sir also, if he is there.
I think Sandeep sir,
He said he will join for a minute to say hi. He's on military some kind of training for promotion.
no, I think he's not there, ma'am.
Okay. Because I told him 10:20. Last time it was 10:20. I don't know, the time keeps on changing or what.
Mhm.
Anyway, I'm here.
Good morning, ma'am. Good morning, sir.
Morning, ma'am.
Good morning.
Fatima.
Ji. Good morning.
Good morning, ma'am. Good morning, Vinod, sir.
Good morning.
Well, and this was a three-folded occasion, 14th of February, Valentine, and then Mahashivratri, and then
Yes.
Black Day. So there are mixed emotions.
Yes, ma'am.
40 were killed in Pulwama.
Ma'am.
And where is Swati, madam?
Just
Yes,
now she
ma'am.
said
Good
no.
morning.
Is the only
Good
ma'am.
Ma'am,
morning. Ji. Good
ma'am,
morning.
video is not working. I am seeing क्या उसमें हो गया. The video is I'm unable to see. I can
What
hear, I
happened?
can see, but some setting issues in laptop.
Yeah, it's your issue only, ma'am. From the laptop, yours only it is. Through phone you can
Okay.
join. No?
Okay.
That is also fine.
Yeah. Always this
Good
you
morning,
actually, you know it. I don't even know how to fix it.
Ma'am, shall we?
Yeah, please, I'm asking you. We should.
યસ આને અવાજ બી ઠીક નથી ફાટે છે. Good morning, ma'am.
Good morning, Ji.
How are you, ma'am?
Great. And what about you guys?
Yes, ma'am. I am also fine. Thank you, ma'am. Good
Last
morning,
night,
Raman, ma'am.
Good
Neeru
morning,
is-
Neeru.
How are you, ma'am? After so long time, I'm seeing you, ma'am.
Because you
Look at
don't
the-
find chance to see me. That's
Yes,
why.
ma'am.
Oh, good.
Really auspicious day. Really, it's a very auspicious day for me. As madam also told, many occasions also are there. And meeting you, it's really a good luck for me, ma'am.
Oh, look at the smiling other face, Swati Ji, after a long
Yes,
time.
ma'am. It's done, ma'am. Some setting
Yes,
issues were there.
and
Good morning,
so
ma'am. Good morning, Raman, ma'am.
Good morning, good morning. Ma'am, shall we start?
Yes.
is-
Ma'am, shall we start, ma'am?
Yes, Muttu sir, yes.
Yes, ma'am. So, good morning to all respected dignitaries present here, esteemed faculty members, research scholars, and research guests. So, I welcome you for the NSS webinar series 13, that is today, February 15, 2026. To Chowdan Hour. Before starting with it, just I wanted to quote one this thing. Research is to see what everybody else has seen and to think what nobody else has thought. It is according to Albert Einstein. So with this, I just want to happy Shivaratri to all of us.
Same to you,
Yes.
sir.
So
Same to you.
myself, Dr. Muthu P. Chowdannavar, and I am the president of NSS Force Chapter 15 Karnataka. Additional doctoral degree along with has completed my MSc in Community Health Nursing and MBA in Hospital Administration. I worked as NIH consultant as clinical auditor and certified around 15 hospital NIH until 2 hospitals were full accredited hospital. And I have received many certificates, awards, published many articles in effort journals, and I am joined the TOT and I have been certified with the TOT Midwifery Faculty Development Program from NRSC New Delhi and certified internal assessor for Kayakalpa NQuas Muskan Laksha program, and also I have certified with Lean Six Sigma And I'm a life member of nursing association societies like TNA, NTI, NSS, NHS, IPN, etc. I'm a certified master trainer in simulation based education from NRSC, New Delhi. And from our association, we conducted 3 international webinars. And now I take this opportunity to introduce our patron ma'am, Professor S. Narula Khanna ma'am. Madam has 45 years of professional experience in variety of settings such as teaching, practice, administration, and management. Madam have published extensively in referred journals and authored a book, Historical Perspectives in Nursing and Indian Nursing Leaders from 1947 to 2024. The third edition is in print. Madam has been a TNA branch president for 10 years in USA and Canada. Madam was the national representative of TNA at the United Nations for NGO conference. Madam is a patron of 4 prestigious nurse societies in India. That is CNRS, NHS, NTI, our NSS. Madam worked as a director of nursing in Gwalior Sophia Nursing College, GNC in Jaipur, and Mahatma Gandhi University. Madam works as freelance consultant of curriculum development for nursing college. I request Madam to give her message. Over to you, ma'am.
Sure. Thank you, MC, for this glowing introduction. Respected Binu sir, Dr. Rita Darji, Dr. Asha ji, Dr. Swati ji, Dr. Indra ji, I want to recognize everyone because I'm so happy the family is together. And Mrs. Niro Patel ji, and the presenter Dr. Raman Kalia ji, Dr. Bhuneshwari Das ji, and where is Bhuneshwari Das ji?
Madam is there, ma'am. I think she's joined.
Madam, good
Okay.
morning.
Don't forget to ask her correct spellings.
Yes, ma'am. Yes, ma'am.
Madam,
And
good morning, ma'am.
our lively audience. This is such an auspicious occasion to continue our 2026 year with another webinar series of research presentations. It gives immense pleasure, motivation, and encouragement to NSS headquarters by the lovely feedback from our respective members and attendees to continue this effort. My best wishes and God's blessings. And this event should be a brilliant success. I will be seeing you in a later session of induction, and my best wishes and God's blessings. On to you, MC, or I am going to say introduction of President.
Yes, ma'am. Please, ma'am.
Okay, next slide then. It is already there. Okay, it is my pleasure to introduce our founding NSS President, Dr. Binu Jo, who is a gold medalist and is currently working as principal in Rajkot. He has 16 plus years of professional experience and is actively involved in enhancing our NSS mission. He has conducted many national and international workshops and had been key proponent in our successful recent international conference in collaboration with Vibrant College of Nursing in Surat. And there will be next in 2027. He has published many research articles in referred journals and has authored a textbook on pediatric nursing. Sir is lifetime member in many prestigious professional societies and on additional editorial boards of referred journals. He is a pillar of our NSS society with a one word YES, and we are here today and just growing. I am not going to say minute by minute, but we are growing. And thank you to sir for being with us, and to you, sir, for your message. Binu, sir.
Yeah, very good morning to one and all. Respected honorable dignitaries present here, a warm greetings of the auspicious day. It's really great honor to be with you all in this 13th research webinar series of Nursing Scholar Society. Yes, every research reflects the commitment of the true researcher towards the betterment of the profession. And yes, I am very thankful to all of you who have come forward to disseminate your research knowledge. I'm looking forward to hear from you all great researchers. And I take this opportunities to thank each one of you who have come forward to attend this research webinar series. Thank you all once again. Thank you.
Thank you, sir. Thank you for your wonderful message, sir, and blessings. Now I call everyone for digital lamp lighting. all the dignitaries.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
Very nice.
Thank you.
Nice.
Thank you all of you for joining this. And this is a today's brochure. And once again, I welcome you all for today's research presentation. This academic gathering reflects our commitment to scholarship, innovation, and evidence-based practice. Today, we have an opportunity to listen to eminent researchers. That is, first one is Professor Raman Kalia ma'am. Second one is Professor Bhubaneswar Das ma'am. Who will be presenting their doctoral work. Their research not only contributes to knowledge, but also strengthening academic and professional practice. And today's special guest, Dr. Neeru Patel ma'am, and Dr. Indra Moja ma'am, and myself, today's Master of Ceremony, and a guest of honor is Dr. Swati Patnawala ma'am, and resource person. And resource person two is Dr. Ashay Kuresh ma'am, and chief guest is today's session is Professor Rita Dharma. Now I take this opportunity to introduce our chief guest, Professor Rita Dharma. Ma'am is an advisor of Organ Donation Kidney Warriors Foundation and national mentor and external NCOS assessor, academician, author, and public health advocate. Ma'am is a senior academician, researcher, and national level organ donation advocate with 3 decades of experience in health education and public health leadership. She earned her PhD from JNU, undertaking pioneering case studies of National Organ Tissue Transplant Organization, focused on brainstem diseased organ donation. Her research highlighted awareness gaps, social culture influence, and family consent dynamics, strengthening culturally sensitive counseling and evidence-based advocacy in India. Madam has 17 research publications in national and international journals, spanning organ donation, health decision making, psychology, mentoring frameworks, and health quality systems. Her organ donation advocacy model received formal recognition and commendation from NATO. For impactful community engagement and professional sensitization, she is widely appreciated for innovative outreach initiatives, including culturally rooted communication models and interactive awareness program that simplify complex transplant concept for the public. Madam is the author of Textbook of Organ Donation, a multidisciplinary perspective covering medical, ethical, legal, psychological, and social cultural dimension transplantation. Madam served as a national mentor for state level government official and external assessor for NCOS, contributing to leadership developing patient-centered care and quality improvement in public health institutions. She also collaborates with Rotary clubs on community health initiatives. And Madam as an advisor organ donation to the Kidney Warrior Foundation. Madam provides strategic leadership in awareness, professional education, and advocacy, campaigning organ donation as humanitarian bridge between science and compassion. Over to you, ma'am, for your message.
Thank you, everyone, for giving me this opportunity to be here with you all. With the utmost respect to all the dignitaries, esteemed faculty members, brilliant researchers, and dear nursing professionals, a very warm greetings to all of you. It is both an honor and a privilege to stand before this distinguished gathering to speak on a subject that is not just contemporary, but it is transformational: artificial intelligence in nursing research. We are living in an era where healthcare is no longer confined in hospital walls. It is digital, it is predictive, it is personalized, and increasingly intelligent. And at the heart of this transformation stands nursing, the largest, most trusted, and most patient centered workforce in healthcare. Today, I would like to say with conviction, artificial intelligence will not replace nurses, but nurses who use artificial intelligence will redefine healthcare. I can tell you my own experiences. Can I share my PPT?
Yes, ma'am. You can share more.
Please. Yes. Like my own journey, I started my research when I had to call people to, write the whole research thesis for me. I had typist beyond me who would write my thesis in 1988. But in 1990, in 2009, I wrote second thesis and I did it on my own, writing on computers. And in 2021, when I got PhD from Jawaharlal Nehru University, I had written this thesis, a voluminous thesis on my own using computers. But today I feel the need of artificial intelligence. It's very important that artificial intelligence be interwoven with nursing profession, and it has already reached the subcenter level. It has reached everywhere now, and without it, it is not. It has really improved quality care. It has also improved, the work which we had been doing for long, laborious work. It has reduced that laborious work also. And so I would like to share the PPT with me. Is it visible?
It's
Yes.
on.
Yes, ma'am. Yes, ma'am.
So we are living in an era where healthcare is no longer confined to hospitals, as that I have already told you. And I would like to say that, yes, nurses can, they have to learn. They cannot do without learning AI. We have to learn, we have to come forward and learn things on our own through our organization, but we can't wait to learn these things. I have also started learning this. And I think it's really, it is simplifying my task also. You can see that India has a population of over 1.4 billion people, creating one of the largest and most complex healthcare demands in the world. Now we have Ayushman Bharat, all of you are knowing, and more than 50 crore beneficiaries are entitled to health coverage, generating massive volumes of clinical and public health data. We have a lot of volumes. When I go to to sub-center level, to PHC level, and to CHC level, people, because I am NCOS assessor, I assess these health facilities. I know that they are generating a lot of data. They have so many portals. They are entering data in so many portals, and we are generating huge data. But without AI, it will not be possible for us to, develop generate massive, generate the outcomes of this data, find solutions to these evidences. So through eSanjeevani telemedicine services, India has already crossed 10 crore teleconsultations. Our CHOs, community health officers who are posted in sub centers, they are generating a lot of data through consultations, which I am observing. They do teleconsultation, and it has eased their processes, and it is making it one of the most largest telehealth platforms. These numbers are not just statistics. We cannot think that it is just statistics. They represent lives. They represent families. They represent their vulnerabilities as well as hopes. And within this expanding digital ecosystem lies an ocean of data waiting to be interpreted responsibly. We have to interpret this data responsibly, and AI does that at ease. And we have to take care of, we have to, train ourselves to the coming needs of our nursing profession. Now, who better than nurses who stand closest to the patient? I think we know patients much better than the doctors. I have seen in hospital settings also when I was a student that sometimes we understood the moods of the patients in a very nice way. In one case, doctor could find that the patient was suffering from depression, because he would always complain. But we knew that his activities, and we had closely observed, and we said no, he's suffering from mania. He is agitated all the time, and he's trying to suppress others with his manic symptoms. So we are better who stand. We are better in the health professions. In health profession, as we stand closest to the patients, it's important for us to learn AI. So traditionally, nursing's research focused on patient care practices, quality improvement, psychosocial dimensions, and evidence-based intervention. It relied heavily on manual data collection. I have seen that we used to collect manually data. Even Dr. Sue Khanna will also understand when we used to go to Chawla, we would prepare, that data of 100 families on these sheets, manually, collect data of surveys and do write what did you find, how many people were non-veg and how many were taking vegetarian food, how many families in which age group, all these things. And it was really difficult. We will, paste page together and develop this material and develop this statistical data manually, and it was really difficult. It was really it used to take all our energies for that. But nowadays we have Excel sheets, we have so many things, and we have now AI, which is coming forward to help us in doing these things, so that we do something other better than that. Today the volume of healthcare data is enormous. Electronic health records, wearable devices, telehealth platforms, community health dashboards. The question is how do we transform this ocean of data into meaningful knowledge? There is where artificial intelligence becomes not just useful but essential. It is essential. It is not only useful, it is essential. Now, what does AI bring to the nursing research? AI enhances nursing research in 5 powerful ways. It does predictive analysis. It gives big data interpretation. It interprets huge data, and it helps in clinical decision support research. Then it helps in natural language processing, simulation and training research. We will go to these things in one by one. AI can identify patterns in patient deterioration, read risks, infection outbreaks, and chronic disease progression before they become visible to the human eye. For nurse research, this means designing preventive care models, creating early warning systems, strengthening patient safety framework. So big data interpretation, instead of analyzing 500 patient records, we can now analyze 5 lakh records in a minute. AI helps us detect trends in population health, understand behavioral and psychosocial patterns, and study long-term outcomes at scale. Clinical decision support research, AI-powered tools assist nurses in making evidence-based decisions. Research can now evaluate accuracy of AI-based triage systems, efficiency of AI-assisted documentation, impact on nursing workload and burnout. Fourth is natural language processing. Imagine analyzing thousands of nursing notes to understand patient emotions, symptom progression, or communication gaps. And AI can extract themes, which used to take a lot of, we used to do a lot of exercise to extract themes from, from data, which we get from quantitative data. We used to find the sentiments from quantitative data ourselves, which is sometimes difficult, and then patterns that were previously hidden, but now we can see through this natural language processing of AI. Fifth is simulation and training research. AI-driven virtual simulations are revolutionizing nursing education research, creating adaptive learning environments and personalized training modules. But let us pause and reflect. As we embrace AI, we must also ask, are we protecting patient privacy? Are algorithms free from bias? Are we training nurses to critically evaluate AI outputs? Are we preserving the human touch in care? Uh, Nursing is not merely a science, it is also an art. No algorithm can replace compassion. No machine can substitute empathy. No predictive model can comfort a grieving family. It is all nurses who can do in a very human way. AI must assist nursing, not dominate it. So, in a country like India, with vast population, rural urban disparities, and workforce strategies, AI offers immense potential. Telehealth supported nursing research in remote area, AI assisted screening in primary health centers, data driven public health nursing models, resource or optimization in government hospitals. But this will only succeed if nurse researchers are also included in policy making, technology design, and digital innovation. And I think which is not being done. We must not be passive users of technology. We must be co-creators. We should create these tools along with with others. Now, the way forward to truly integrate AI into nursing research, we must introduce AI and data literacy in nursing curriculum, encourage interdisciplinary collaboration between nurses, data scientists, and engineers, establish ethical AI guidelines specific to nursing practice, promote funded research projects in AI-enabled nursing innovation, empower nurses to lead, not just participate in digital health transformation. A message to young nurse researchers: do not be intimidated by artificial intelligence. Learn it. You have to question it also. You have to research it and humanize it, because the future nurse researchers will not only collect data but will design intelligent care systems. As a chief guest today, I leave you with this thought: artificial intelligence can make healthcare smarter, but only nursing can make healthcare humane. When technology meets compassion, when algorithms meet ethics, when data meets dignity, there is where the true future of nursing research lies. Let us not fear the future, let us shape it. Thank you and Jai Hind.
Thank you, ma'am. Thank you so much for your insightful session on artificial intelligence nursing. As you emphasize that AI is not there to replace nurses. That's truly said, ma'am.
Yes.
Share my screen, ma'am.
Help us. It can help us. It is not to replace them. It can help us.
Exactly, ma'am. Exactly.
Like if I tell you my own story.
Yes, ma'am.
When I was a student in 1988, I used the the services of a typist. I used the services of an editor.
Yes,
When I did masters in public health in JNU in 2009,
yes, ma'am.
I did not use them. I used Grammarly.
Yes, ma'am.
I used called plagiarism. They were using Triton tools. Find out whether my thesis is plagiarized or not. So, but that doesn't mean that I did not use my work is gone. But now, when I tell AI to please generate an article for me, which will link organ donation with marriage of a daughter, it will not be able to. It will not be able to. It is not able to do that, because the way I have written, I have chosen the narratives of the people whom I had interviewed, and I had it could not do that.
Yes,
And when I tell AI to please prepare an article for me linking organ donation with linkage of organ donation with Maslow's hierarchy of needs, which I have written, it is not able to do it. It will not do it because I have my own narratives with me. I have patient narratives with me. My my mind is working with all these things, so it cannot replace me. And when I prepared a tambola on organ donation myself, and I have uploaded it on AI, and I told him, I told it, please prepare a video for me. It prepared a video for me. It is
Yes.
acting as a subordinate to you. It is not, it is not helping. It is helping you. I think right now it is helping you. I don't know how it will be used in future, because internet services have helped, but it has also pickpocketed you also in many ways. So we do not know what will, but we have to keep abreast. You have to. I try to learn things. I try to learn things from people around me. So even at this age 65, when I meet co-assessors and I try to learn, please tell me how to make video out of this. Please try to. So I can think it can generate lot of. It can
Really?
generate lot of things for me. I don't
Morning,
need
ma'am.
personal assistants now. I don't need personal assistants now.
Yes, ma'am. Thank you,
Yes,
ma'am.
ma'am.
Thank you so much,
I
ma'am.
have guide.
Yes,
To
ma'am.
tell you the truth, I feel I have a guide in AI. It tells me what to do. I have the personal assistants with me also to help me.
Yes,
So
ma'am.
don't think it will replace you.
Yes, ma'am. Thank you.
That's okay.
Thank you, ma'am.
Okay, over to you.
Kanna, ma'am, anything you wanted to add? Kanna, ma'am, anything you wanted to add?
Unmute.
I
Ma'am,
think
unmute.
we should go right away to Ramanji.
Yes, ma'am. Now I take this opportunity to introduce, welcome our first presenter, Professor Dr. Raman Kale, ma'am. Over to you, ma'am.
So good morning, everyone. Good morning, Suresh Khanna ma'am, respected chief guest for today, Dr. Rita. Other guests, Asha Qureshi ma'am has joined recently. I suppose ma'am is here. Neeru
Ma'am,
Patel, Bhuvneshwari Das, and the other guests. It's my pleasure to be present here today for this webinar series. As we just listened to artificial intelligence presentation by our chief guest today, it's so inspiring. Over to this, ma'am, I think similar journey people in our age had, who did graduation in 80s, post-graduation in 90s, and PhDs in 2000. Then we really learned like this, from WordStar typewriter to the Microsoft Windows, and then advancing to the AI now is a learning journey. And we are so fortunate that we have many younger colleagues with us who are day-to-day help to teach us. Even making many things on the apps and the mobiles and the laptop. There are many websites. Recently, I was away for INC inspections, and we have to collaborate a lot of photographs in that. I learned how to make collage from someone around in the inspection because they have to upload the photos in that particular GB. That size of photographs. Right. But as ma'am said, really we as nurses, when we work with patients and we work with human minds. Of course, all these technological advancements will be helping us and are of course a great use to us, but we have to learn and we know how to use these. But as we work with patients for research, we come across different studies. Of course, during our student times, we also have done the manual data collection. Now there are many tools, but everything has to be very, very ethical and honest in research. That's what is important for us to keep in mind always. So we should be working for the patients and whatever possible technology we have, of course. So without wasting time, I think I should. Yes, ma'am.
Ma'am, unmute
You are
yourself.
mute, ma'am.
Unmute. Khanna ma'am, please unmute. Asha ma'am is here. Unmute.
Okay. You did not give a brief introduction about yourself, ma'am.
Oh, sorry, ma'am, I forgot.
That's
I
all right.
forgot.
but other
Yeah,
people-
hello everyone. Good
Thanks for
morning.
reminding. Thanks for reminding me, ma'am.
Okay, please.
Good morning, everyone.
Good morning, Asha ma'am. Good morning.
Hanji.
Okay, go on to your.
So I'm
introduction.
honored to be invited, and I'm happy that somebody has given my introduction. I'm sorry for joining you late, you know,
No,
due to
ma'am.
my
Next week,
health problem.
Next week,
नहीं आई है
week.
PPT
Can you hear me?
Yes, ma'am. Good morning.
Okay. So it is my honor to welcome you to this, research presentation. I mean, what is the session? I mean, 7 series, and
13.
organized by the Nursing Scholar Society. Today we gather to celebrate a milestone of academic journey because this particular research presentations, is really required for the profession, and we have to. We know that we are. Academic journey is not possible unless we upgrade ourselves, And as you take the significant step, all of you are here, you are taking the significant interest and steps. Remember that nursing is not just a career, it is calling of the serve humanity with the empathy, expertise, and kindness. The Nursing Scholar Society embodies the pursuit of excellence in healthcare, and I'm confident that you will uphold the value of it. So, congratulations to all the well wishes to all the presenters over here today, and all the dignitaries over here. I give you I'm taking sedation. Doctor has given me sedation, so I'm having little problem. So I would like to congratulate to all those who are prepared for the research presentation, and namaskar to everyone.
Thank you, ma'am. Thank you. Ma'am, actually, okay, ma'am. Thank you. Raman, ma'am.
Yes, my slide is visible.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Okay. I am Dr. Raman Kalia, currently working as Direct Principal at Saraswati Nursing Institute in Punjab. Earlier, I have studied my graduation, post-graduation and PhD from PGI Chandigarh. Had been working in College of Nursing for about 28 years. I took VRS and joined this institute as principal. Currently, I am serving on various platforms. Chapter President of Nursing Scholar Society. I am also North Zone Secretary of Nursing Research Society of India, member of TNAI. I am a founder president of Nursing Research Forum, and since 2003, we are continuously publishing a journal, Nursing Research and Midwifery Journal, which is now published by SAGE, and I am the chief editor for the journal. I do work in the college, so I'm not much directly involved in patient care and research these days. My college is, of course, postgraduate and PhD center. I'm also mentoring PhD scholars of Indian Nursing Council Consortium, Baba Farid University of Health Sciences, and of course, guiding the MSc Nursing students. The research I'm going to present today is also a little work done as a project, continuous education project of students in health center, where we have worked for the patients who are undergoing hemodialysis, and we just tried to explore their lived experiences. As in the previous presentation also ma'am said, now the lived experiences and all these, we have to analyze them by generating themes. Now AI can help us, but still the human element or the patient element, we have to put our emotion into it. And when we provide care to the patients, we do come across various kind of emotions and various problems and stresses of these patients. So this study was a small study where we tried to assess the lived experiences, psychosocial stresses, and coping strategies of the patients who were undergoing hemodialysis. In today's world, it says that the technology, of course, is advancing, but the primary goal of promoting the general well-being remains with the healthcare workers. And end-stage renal failure is a chronic disorder. This is consistently increasing over the last decade, and dialysis is an appropriate treatment for renal failure. Of course, there are a variety of devices and machines which have been developed to help people recover from serious terminal illnesses. And hemodialysis is a renal replacement treatment that causes various physiological and psychosocial problems for the patients who are undergoing dialysis for a long time. They are prone to have multiple stresses, and they also experience many lifestyle changes and adjustments and personal losses because of the chronic disease. A strict diet and continuous treatment are other stress factors that people on dialysis do come across. But each individual or each patient has a different level of handling stress. So it is significant to learn, recognize the effect of person's physical and mental health. End-stage renal disease has become a major cause of global morbidity and mortality, even in developing countries. Many authors indicate that a large percentage of dialyzed patients demonstrate anxiety and worry about the future. Additional stresses associated with end-stage renal disease include biochemical imbalances, physiological changes, neurological disturbances, cognitive impairment, and sexual dysfunction. There is a need to conduct an in-depth assessment of each patient's experiences. With this small purpose, we wanted to dig deeper into the patient's experiences of psychosocial changes which are associated with the disease. Of course, economic issues and financial liabilities are also one important aspect for these patients who are undergoing treatment for a longer time. The objectives of the study were to assess the psychosocial changes and coping strategies adopted by the patients undergoing hemodialysis, to explore the lived experiences among patients with end-stage renal disease. Assumptions. Patients with end-stage renal failure may experience different kinds of complications. Patients may encounter stresses in daily life. Disease and its treatment affect patients' normal daily life. Patients use different coping mechanisms to deal with stressors. This study was only delimited to the patients who were undergoing end-stage renal disease and were present in the renal selected hospital during the data collection period. Few of the things were operationally defined for the purpose of study. End-stage renal disease refers to the final permanent stage of chronic kidney disease, where kidney function has declined to the point that the kidneys can no longer function on their own. Psychosocial changes are related to the combination of psychosocial and social behavior and affect the mind, especially as a function of awareness, feeling, or motivation. Coping strategies in the present study, it refers to the specific efforts, both behavioral and psychological, that people employ to master, tolerate, reduce, or minimize stressful events. Lived experiences refers to a representation of the experiences and choices of a given person and the knowledge that they gain from these experiences and choices. The conceptual framework of this theory was based on Stuart's stress adaptation model. I will not go in much detail, just highlight the predisposing factors which are present. Psychologically, stress, motivation, self-concept, and certain biological factors of age, gender, nutritional status. Sociocultural, income, education, occupation, and there are certain precipitator factors which are life strains and strainful life events. However, chronic renal disease is known to be an idiopathic, but still there could be some factors which can cause disease in many patients. There are certain physiological factors which could be or could not be associated to the occurrence of disease in many patients. But patients, once they are suffering from this disease, they do have withdrawal behavior, isolation, or self-blame kind of things, and have to resort to many coping resources. These coping resources are in the form of social support, social skill, communication, good IPR. Certain personal abilities of the patient also help the patient to cope with them. Family or marital status, of course, and a belief in knowledge, attitude, and motivation serve as the coping resources. So patients do take certain coping mechanisms to adjust with the problems faced. Many times these coping mechanisms could be denial, humor, or even substance abuse. But to solve the problems by coping strategies, patients do resort to positive reinterpretation, planning, and acceptance of the diagnosis. And as nurses, we have to take care of the patients and help them to adjust. Few of the important literature reviewed also studied stress upon the role of stressors hemodialysis patients undergo. And in majority of the studies, it was found that the patients had moderate to severe level of physiological stress, and many patients were confronting with coping strategies of self-control and avoidance behavior. Also, in some studies, it has been found that physiological stressors and psychological stressors are present in many patients. That's how we also tried to find out the stresses present in our population. In this study also, in a semi-structured interview schedule was used, and the patients spend a lot of time with healthcare. So the patients many times get support from psychological support and empathy from the medical personnel or the healthcare workers. If nurses are around or medical personnel, they do get positive counseling and support from the patients. The research methodology undertaken from this study was research approach, mixed method approach. This was quantitative and qualitative both. So, sorry for that mistake. It's qualitative and quantitative both. Research design was sequentially explanatory design. Research setting was the hospitals around our college. These were the private centers where patients were coming for the dialysis treatment. Population, patient with end-stage renal disease. Target population were clients undergoing hemodialysis. Accessible population were those who were present during the data collection time. And it was 50 patients who were interviewed for quantitative findings. Purpose sampling technique was used, and 6 patients were enrolled for qualitative analysis of their lived experiences, exploration of their lived experiences. The tools and technique used for socio-demographic variables, health profile pro forma. The responses were recorded by the researcher in one-to-one interview, and semi-structured interview schedule was used for in-depth interviews of the patients for collecting the qualitative data, and these were tape recorded. BREF coping scale is a standardized scale which was used for the patients in the interview process, and hemodialysis stressor scale was used. This is also a standardized scale. This was also used for the patients to assess the stressors caused by the hemodialysis and what are their coping strategies. These 2 were the standardized tools, and rest of the 3 tools were self-developed. This was the scoring criteria based on these tools. Validity and reliability of the tools was assessed, content validity of the self-structured tools and the reliability of the other tools, and the validation was done. In the data collection procedure, prior ethical approval and permissions were taken. Participants meeting the inclusion criteria were selected on day 1 and informed consent was obtained. Each interview lasted about 15 to 30 minutes, depending upon the patient. It took longer also for some patients. Following the self-introduction and explanation of the studies, tools were used, and the BREF coping scale and the hemodynamic stress scale was also used to collect and assess the findings. Ethical consideration, ethical approval was also taken from the Institute Committee, Ethical Committee, and prior permission from the hospital administrations was taken as per procedures. Written informed consent was also obtained from all the subjects, and the purpose of carrying out the research was well explained, and the confidentiality of the participants was ensured. During the data collection process, the various demographic variables were assessed. It was observed that majority of the patients in prime of their youth, the age was from 15 years to 47 years. And these are the years when the persons are having their livelihood, family life, and the life is affected because of the hemodialysis. Majority of the patients were female and had secondary education. Also, the monthly income of the patients were between 10,000 to 20,000. Majority of the patients were in this income bracket, and this is just an below average type of income in our country. And majority of the patients never had a disease, a history of kidney disease, or had undergone any family member in hemodialysis for them. And hypertension was a majority patients were suffering from hypertension. So even hypertension is associated with occurrence of kidney disease in many patients. It was explored the duration of the sickness. So patients had more than 2 years duration. Majority of the patients were undergoing this chronic hemodialysis treatments more than 2 years. There were majority of the patients who just started. So we had made the categories, and there were 27% patients who were undergoing dialysis since 1 year, but majority of them were suffering more than 2 years. And majority of the patients were having hemodialysis twice a week. We did try to assess the coping strategies and try to find out what coping strategies patients were adopting. It was seen that active coping was adopted by many of the patients in adjusting to the disease, and they were taking action to try to make their own situation better by positive reinforcement among themselves. But little bit denial was also observed in many patients. They were refusing to believe that it has happened. Denial is a strong emotion expressed by many patients who are having chronic diseases, suffering from chronic diseases, cancer, kidney disease, and all. Why me? Also, the patient used emotional support. Many of them reported that they were getting emotional support from others, comfort from others, as reported by patients. Also, positive reframing was observed to a larger extent. Patients were trying to be positive during the treatment and were hoping that they'll be recovering. So many patients reported that they were looking for something good in what is happening. Some patients were trying to be making fun or being positive, adapting to the disease. And many patients said they had been doing some planning or strategy what to do, because it is thinking hard steps they have to take because of this chronic disease. So mixed emotions and mixed things were seen, and mixed coping strategies were observed among the patients. Of course, acceptance of the disease is one thing which is very, very common, and patients do take time to accept, but majority of the patients in our setup exhibited acceptance of the disease. They were having good belief in God and were also praying and meditating. So in the whole, it was observed that 41 patients, that is 82% patients had adopted to the average coping strategies with the disease. Then we tried to assess the stressors as well as per that standardized scale. This, as per the scale, the stressors are physiological stressors and psychosocial stressors. In physiological, the AV fistula is the common physiological stressor, of course, but still 76% patients never felt AV fistula as a stressor because probably the patients are thinking that this is the lifeline. So they are adjusting to the AV fistula occurrence in their body as a permanent and an important thing. Then stiffness and joint itching, these are also common symptoms seen among the patients, but patients are accepting to these also. But feeling of tiredness was reported by majority of the patients because fatigue is also one. we later did a study on fatigue as well, because in this study we found that many patients were having this feeling of tiredness. Length of treatment and loss of body function was also reported as a bigger stressor among psychosocial stressors by majority of the patients. And majority of the patients moderately felt that limitation of foods and fluids because of the disease was also one psychosocial stressor. It is very, very important to live with food and have food choices. But in this disease, foods and fluids both are strictly limited to the use. Even water patients have to measure and drink. So this is something depriving a patient from the basic needs. So, but patients were moderately adjusting to this also. Limitation of physical activity because of the disease was a major psychosocial stressor by many. And many patients had sleep disturbance and changes in family responsibilities as psychosocial stressors because the disease was affecting the family responsibilities. Reversal in family role and reversal in the role of playing the role of parents or spouse was also a great psychosocial stressor presented by majority of the patients. Majority of the patients did express the uncertainty about the future. Of course, the treatment is available now for hemodialysis, renal transplant and everything, but still patients who are suffering from chronic diseases do certainly feel some uncertainty about future, and this cannot be denied. We can just be supportive to them. Cost of treatment also is a bigger thing because patients who don't have any access to insurance or free treatment, etc. Apart from the treatment, there are extra charges, extra transportation problems, diet problems, and other things. Patient did express that they had limited time to visit place and all for vacation. And frequent hospital admissions are also disturbing majority of the patients. A frequent visit to the hospitals. If the person has to come twice a week to the hospital for hemodialysis, it becomes a lifestyle or a routine life thing to be done. So these were some of the physiological and psychosocial stressors observed among many patients. And average stress was observed among majority of the patients. And there were about 14% patients who had high stress. Apart from this, at our own, we tried to identify the common health problems of these patients. Apart from hemodialysis, many patients experienced pain, breathlessness, anorexia. Hypertension, diagnosed hypertension is one cause of CKD. Patients did express fatigue among the miscellaneous complaints. A majority of the patients expressed fatigue. For qualitative analysis, the Colizzi strategy was used. Of the qualitative, all the statements, bracketing, intuiting, analysis, and descriptive phase are the steps of this analysis. And of course, all the data collected was actually first transcribed. All the tapes were heard again and again to just to generate the themes and formulate an idea. Then these were transformed again on the sheets. Transcripts were prepared and formulating meanings was given. Categories and cluster of themes was done. Next, There was exhaustive description of the phenomena, because when you talk to these patients, you try to explore their lived experiences. The patients want to talk, patients want to tell everything they have undergone. And exploration of lived experience is probably the most time-consuming form of data collection among patients who are suffering from these chronic diseases. But still, you have to put an exhaustive effort for reducing the themes which has been extracted from the patients, and then seeing or validating an exhaustive description of the fundamental structure of the themes, and we have to organize these themes. So the major themes arised out of the thematic analysis were the physiological problems, nutritional problems, psychological, financial, and transportations. Theme 2 was perception towards hemodialysis, which was positive among many patients as well as negative. Perception towards healthcare workers was also observed. Treatment adherence and knowledge about end-stage renal disease was also observed as a theme. Also, the impact of the disease on family and society was expressed by many patients related to the spouse and society problems. Lifestyle changes mainly was dependency on hemodialysis. Many patients knew and expressed that they have to depend on hemodialysis. Not everyone can undergo kidney transplant. Unemployment and loss of job was also one major lifestyle change which was expressed by many patients. Did patients had belief in God, and religious beliefs were also expressed by many patients. Let's discuss the findings in comparison to the other studies conducted. While the coping strategy and psychosocial changes, in the present study, it was seen that majority of the patients had average coping strategies, and 16% had good coping strategies, and only 2% patients had poor coping strategies. In a similar research, it was observed that 50% used emotion-focused and problem-oriented coping strategies, while 90% of the patients sometimes used avoidance-oriented coping strategies. And other 56% sometimes used seeking support and isolated thoughts as coping strategies. So the findings of the current study were also similar to this finding. Also, in the present study, we observed that a majority of the patients had reported physiological stresses related to feeling of tiredness and fatigue, and psychosocial stresses as limitation of fluid and reported limitation to food. In the similar expression of the patients, among 70 patients who were undergoing hemodialysis, the similar findings were observed where majority of the patients observed the feeling of fatigue and limitation of fluid and food done because of the disease. In the present study, the physiological stress related to tiredness and psychosocial was observed. In another study, again, the similar findings were observed where patients had reported severe psychosocial stress, food limitation, length of treatment, sleep disturbances. All these findings were observed in the current study also. The most frequently observed physiological stressor was fatigue in this study also. When we assessed the lived experiences, the results showed that most common reported experiences were effects on family and spouse, dependency on hemodialysis, belief in God, and healthcare for perception towards healthcare workers. In a similar research done by other authors, also lived experiences related to family, society, economic, and job impacts were observed, and the patients did had positive feeling about the healthcare workers. Dietary restriction was also similarly observed in the other studies also. Of course, physical problems, nutritional issues, financial and transport issues were also expressed and observed in the lived experiences of our patients. In this study also, the lived experiences and the themes on physical care, psychological support, and education related to the disease were observed by the authors. So the findings of most of the studies which were reviewed were similar to the current study population. Then we come to the nursing implications of the study. The major implication could be just teaching and taking responsibility to each patient and among each other. Teaching sessions can be conducted for staff nurses for helping the patients to reduce stress and their coping strategies. And each patient will present with individual physical problems. Sometimes you have to address your care as to the needs of the patients. So there cannot be standardization of any care, but counselor roles can be important in the hospitals. And the nursing administration can take charge of providing in-service education, special training programs to various nursing professionals. So along with the care, they can just counsel and help the patients for adjusting to the disease. For recommendation for future research, a similar study can be replicated on a larger sample. A comparative study can be done to assess the psychosocial changes and coping strategies among patients of renal transplant or hemodialysis. Both are chronic problems, and patients have to undergo later on also many follow-ups. The assessment done by the researchers will provide the baseline data for various other nursing personnel for carrying out various therapies for the patients undergoing hemodialysis. And an experimental study can be done in bigger hospitals where patients need are much at. You don't have staff shortage. One can help in relaxation, organizing relaxation programs, studies on reducing the stress levels or enhancing coping strategies among patients who are undergoing hemodialysis. We do take care in doing research, but still there are certain limitations of all research studies. The current study was all the patients were interviewed while they were undergoing hemodialysis, or they were coming for hemodialysis, either waiting for hemodialysis or after the hemodialysis. So there are some limitations during this data collection process, which could have affected the views expressed by the patients. They are always under stress when they are in the hospital, and it could influence the flow of conversation with the researcher, and patients' ability to describe their experiences sometimes in a socially acceptable manner. So these could be just the limitations of gathering our data from the patients as we come for the qualitative or the quantitative findings. These were the references. And with this, I finish the presentation. If there are any questions or doubts, I'll be happy to answer.
Thank you, ma'am, Dr. Raman ma'am, for that insightful and well-structured presentation, ma'am. The clarity of objective, methodological rigor, and practical implication were truly commendable, ma'am. Your work adds valuable evidence to the existing body knowledge and will certainly inspire further research in the domain, ma'am. Thank you so much, ma'am. If there is any questions, Kanna ma'am, anything you wanted to add? Ma'am, unmute yourself, ma'am.
I was just going to say, just make a brief feedback because it was a wonderful, wonderful presentation. So go to Swati ji right away.
Yes, ma'am. Yes, I will.
Over to you.
Thank you, ma'am. Thank you, Raman ma'am. Now I take the opportunity to introduce our guest of honor and resource person of today's, Dr. Swati Patnavala, ma'am. Madam is currently working as a professor in Rajkiya Medical College in Jalgaon and have 13 years of professional experience in a variety of settings. Madam have published many research studies in referred journals and authored book for forensic nursing in manual procedure for midwifery book. Madam have participated and presented in many conferences at local, national, international level, and have reviewed many nursing textbooks. Over to you, ma'am. We welcome you,
Thank
ma'am.
you. Thank you, sir. Thank you, Muthu, sir. First of all, I would like to thank patron ma'am, Sui Khanna ma'am, and founder Binu Joy, sir, to give me this privilege opportunity to join as a guest of honor to this research presentator. And I would like to see this Raman Kalia ma'am study was so nice, and we have learned a lot from the study also, and it is very practicing or solitary journey with this NSS and this reminding the knowledge and collective assets of research. So it is making a courage to ask and ask to ourselves why and how the persistent research is giving answers to the separate findings, or it will be a bridge gap that capable of achieving such findings. So I encourage to see, I'm getting encouraged also to see the feedback and the critics and catalyst of the next breakthrough of the research. And congratulations to the organizers and to for creating a vital event or vital space for the intellectual exchange. And this master presentation I would love to be a part of again and again, and it's been 7 to 8 years to join with NSS. So I would like to thank to all founder and Sui Khanna man and Muthu sir to be a persistent and continuous encouragement and continuous mastering the webinars and all research. Congratulations to all, and intellectual exchange of this research quantity and quality. Thank you so much. Thank you, ma'am.
Thank you, ma'am. Thank you, Swati, ma'am. Now I take this opportunity to call now we proceed to second presentation of today's academic session. That is Dr. Bhuneshwari Das, ma'am. Now I request to welcome and to give self-introduction of Bhuneshwari, ma'am. Over to you, ma'am.
Yeah, thank you, sir. Thank you so much. Good morning to everybody and happy Mahashivratri to all. As today we all are gathered here for presentation, without delaying much time, I just straight away I'll go for my introduction. Is I'm working as an associate professor in Government College of Nursing, Raigad, Chhattisgarh. I've been experienced for past 24 years. I finished my master's in 2006 and PhD in 2016 from Tamil Nadu. And right, I'm work in our university in that is Ayush University, Raipur. I'm as an guide, research PhD supervisor, working as PhD supervisor as guide also. And many of the universities, they have been appointed me as an examiner as well as paper setter. So that is a fortunate, and I've been the associated with certain organization as a different roles. I've been associated with the lifetime membership of TNI. Then SOMI, our CNRS, I am the National Joint Secretary of the CNRS, State Joint Secretary of the NTI, and member of the NSS also. So along with that, I am a member of IAP, NNF, IAN, etc. So with this my short introduction, just straight away I would like to go to my presentation. So is it possible for me to share my slides, sir?
Ma'am, yeah, this is the only, ma'am, AI nursing. This one or which one, ma'am?
No, mine is research presentation.
No, where you shared with me, ma'am?
I didn't share. Shall I share from my side?
Yeah, you can share now.
Okay. Is it visible?
Yeah, yes, ma'am.
Is it visible?
Yes, ma'am.
Yes.
Okay. So today I'm fortunate to present my second topic in NSS in webinar series. First one, I have presented my own PhD thesis, and this is our interdepartmental research we are doing during our college time. Okay. So it is not so vast like before study, but we are trying to have at least continuity of the research so that we should not be avoided with that. So my research topic is basically it is to compare the study to compare the growth and development among toddlers with and without daycare of the mothers in selected villages of Raigad, Chhattisgarh. As we know that nowadays majority of the mothers, they are working. Many of them, they are still at home. But when we are working, we feel that somewhere we are missing the care of our child. Sometimes we are not able to give time enough in many aspects, right? So in that way, this has motivated me to do this study actually. So this we have done in the rural setup first, because urban side somehow we get some kind of like mates and other benefits and all, but sometimes we may not get. So that initially we started in the villages. So in India, if you say, there has been a high rate of growth of total employment of women So that is 17.3 in 2015 to 39.7 in 2020. So this is the basic statistics which I got it from the Google. And among them, 50%, 52% of the mother with children are less than 3 years of age were in work, and 64% of the women with children of 3 to 5 years of the age they were employed. So this data has been got it from the internet. Then currently 62% of the women with preschool children are employed outside the home. This trend is unlikely to diminish. As a result, the family is subjected to considerable stress as members attempt to meet the challenges of the often contempting demands of the occupational need and those regards as necessary for the reach of the family. This is as per the union. So especially the nutritional status of the children was found to be affected by the lack of time devoted by the mothers on daycare activities as the working status of the mother and type of family, independently and joint. Nowadays, we know that majority of the family are nuclear family, independent family. So we really found very difficult to feed the children sometime because they takes a lot of time to get the food, right? The children cared by the mothers and mothers had better nutrition status than those children who were cared by the servant or other family members in the absence of mothers. See, this is what we practically see also sometimes. So this only motivated because I have seen on my own children. See, when we feed and when we were there at home to take care of my own child, I was there. So we found that she was able to have food and all her activities and many other aspects of growth and development. We felt it is quite okay. But when the caretakers are there and when we were not available, then we saw that sometimes she is not eating properly and they won't report it. So this and all has actually motivated me to do these particular research. So it shows that there is no substitute other than the care provided by the mother. That is very, very true. Everybody we knows that no one can care like mother. So the statement of my problem is a study to compare the growth and development among toddlers with and without daycare of the mothers in selected villages of Raigad, Chhattisgarh district. So the objectives of my study is to compare the growth and development with and without daycare of the mothers. Sorry, to compare the growth among the toddlers with and without daycare of the mothers. Second objective, to compare the development among toddlers with and without daycare of mothers. Third one, to associate the growth and development of toddlers with selected background variables, background data of mothers and toddlers. Sorry. The slides are not moving. Hello?
Yes, ma'am.
Am I audible?
Yes, you are audible, ma'am.
But the slides, okay.
It's moving.
Yeah. So the hypothesis stated for these problem statements were there will be, it is a research hypothesis, so there will be a significant difference in growth and growth among toddlers with and without daycare of mothers. Second hypothesis was there will be a significant difference in development among the toddlers with and without daycare of mothers. Next hypothesis, there will be a significant association between growth of the toddlers and the background data of the mothers and toddlers. The H4 was there will be a significant association between the development of toddlers and the background data of mothers and toddlers. So there are some operational definitions. So first, the growth refers to the increase of physical size of the whole and any part of its body, any parts of it, and whose height can be measured in inches or centimeters, and weight can be measured in kilogram. The body mass index was calculated using Quetelet index. So this is the formula which I have used to measure the growth and development among the child. So the growth of toddlers is classified under this 3 categories. Underweight was BMI was less than 0.14. Normal weight was BMI was equal 0.4 to 0.14 to 0.16, and overweight children were BMI was more than 0.16. So the daycare of mother, it refers to the presence of mothers with the child in daytime during the growth of toddlers. And with here again in the daycare of mothers, with the daycare of mother and without daycare of mother. So in that, with the daycare of mother refers the presence of mother with the child during the daytime from birth to till date. And the without daycare of mothers, that means it refers to the presence of mothers with the child only up to the 4 months after the birth. Or it may be 6 also, because in some time it is written 4 in the research study. So I have taken only till 4 months, because here though we are telling weaning or supplementary feeding after 6 months, some of the mothers, they used to give feeding after 4 months itself. So that's the reason I have taken here 4 months after the birth. The toddler refers here in this study, the toddler refers to the male and female children in 1 to 3 years of age group who were available during the data collection in selected villages of Raigad. So the assumptions of this study are the mother will participate in the participates in the study willingly. The questions in the tool will be adequate and enough to access the growth and development of toddler. Mother will respond honestly to the questioners. Then delimitations. The mother who were present during the time of data collection, the setting of the study was selected villages to accessible to the investigators. So this was the conceptual framework which was based on the growth and development of toddlers, which was based on the day care of the mothers. So this is actually developed by our own. We have not taken any theory, because it was not so, all the demographic variables related to child as well as related to mother, both has been here stated. And here the mothers are with the daycare and without the daycare, those are carrying the toddlers. So here again, for both of the toddlers, for all the toddlers, we have measured growth with the help of Quetelet's index and development with physical motor, development with the index like physical development, fine motor, gross motor, language and speech. These 4 categories has been taken here. So here, based on that, underweight, normal weight and overweight will be there. If we are measuring the development, if we are measuring the growth, and if we are measuring the development, it is adequate, inadequate. So this is the conceptual framework developed by our own. Then the review of literature it is again categorized in 3 areas: studies related to nutritional status of the under 5 children, studies related to maternal employment and health status of the children, studies related to maternal and employment and nutrition status of the children. So this is a schematic presentation of the research design. Directly I am coming to methodology. So here, if you can see here, my target population were toddler with and without daycare of the mothers. The accessible population, target toddlers with and without daycare of mothers in selected villages of Raigad district, Chhattisgarh. So here in background variable, I have taken both toddler data and mother data. The sampling techniques, here I have taken the sample and sampling size. So total, I had 2 groups, and the group 1 mother toddlers related to 45 toddlers with daycare of the mothers. That and the here without daycare of the mothers. That means here the mother were not present all the time to take care of the child in group 2. Then the sampling technique was done in the multi-stage sampling technique, that is non-proportionate quota sampling. I'll explain it later. The data collection method was done in the interview and observation schedule. The tool was here to have the growth and development in step weighing machine, interview and questionnaire schedule was used here. The analysis and interpretation were based on the descriptive and interpretation analysis. The findings and was done based on the anthropometric measurement. That was the criterion measurement that we have used it here. And later on, we have done the methodology. It is again, the research design was used here, comparative design. The variables, independent variable or daycare of the mother with and without, and dependent variable growth and development of toddlers. Associative variables were selected background data regarding the of mothers as well as toddlers. The setting of the study was selected villages of Raigad district, Chhattisgarh, namely Loing, Banora, Gerwani and Litaipali. This is the villages, 4 villages we have taken. The population was target population with and without daycare of mothers, accessible population. This I have told before. Okay, so this is the way I have taken we have come down to the different multi-stage sampling. Okay, so here you can say first we have taken the block level. In that we have 20 panchayats that we have taken. After that 15 villages were there, but we have taken only 3 villages. So here One side the daycare with the daycare of the toddlers and without daycare of the toddlers. So total 45 toddlers in the daycare. In that 12 to 18 months, 15 toddlers we have taken, 90 to 24 months, 15 toddlers, 25 to 36 months again, 15 toddlers. Same way, without the daycare also, like infants, like toddlers, 12 to 18 months, 15 toddlers, 19 to 24 months, 15 toddlers, and 25 to 36 months, again 15 toddlers. So the inclusion criteria, inclusion criteria for my study were, so inclusion criteria in the age group of 1 to 3 years of children we have taken, with and without daycare of the mothers, and the mothers who can understand and talk in Hindi and Chhattisgarhi, the mothers who are willing to participate in the study. The exclusion criteria were, it whose mother were away from both by day and night during the growth of the toddler, whose mother physically ill during the time of the data collection, who were psychologically ill, who had lost their mother on with the birth anomaly or defect, and who were twins. The description of the tool was, again the tool was divided into 4 sections. So here first section was consisted with background data of mothers. Second section, background data of toddlers. The third section was growth, that is a BMI of toddlers. And fourth section was observation and interview schedule of the toddlers and schedule of the development of toddlers. The scoring criteria was based on the body mass index, which is calculated by Quetelet index. The development of toddlers was measured in terms of developmental scores. If the task was present, given 1 marks. If the task was absent, it was given 0 marks. So based on the developmental what are the developmental stages of the child in toddlers, like fine motor, gross motor, and their other developments. Based on that, we have given the marks. The total developmental score was 13 in each group, in each age. The validity of tool was done by 5 experts, including 1 medical and 4 nursing experts. Validity has been done, and content validity has been sent to them. And the reliability tool was done by the inter-rater method used to it was done, and the reliability was found R was 0.86, which was high and reliable. And it was then we have done the pilot study. During the pilot study, the similar setting we have taken, but the villages was different. That is Jampali and Lebda, the 2 villages we have taken among 9 toddlers without daycare of the mothers who fulfilled the sample criteria. Average time was taken for each sample of 1 hour to 30 minutes. The study was found to be feasible after the pilot study. So the data collection procedure, again, it is conducted in 3 villages of Raigad district, Chhattisgarh. It was carried out for 4 weeks in the month of October to November 2025. Then the study was carried out in the 3 phases. So in the first phase, that was an introductory phase. Here, after identifying the villages, every household was verified for the availability of toddlers who fulfilled the sampling criteria. Then mother were explained about the objectives of this study. Informed consent was obtained orally. These phases took around 20 to 30 minutes per toddler. Interview was conducted to collect the information on background data from mother. The anthropometric measurement such as height and weight was measured by using the inch tape and weighing scale. The development of the toddler such as gross motor development, fine motor development, and language speech development was assessed by using the structured interview and observation schedule. This phase lasted for a period of 40 minutes per toddler. In phase 3, that is a termination phase, in that the tool was verified for completion. The mother was assured about the confidentiality of data. The data was recorded as interview and observation progressed. Calculation of BMI was done, and this phase lasted for a period of 20 minutes per toddler. So in this way, we can see here around 1 hour to 1.5 hours have taken for each toddler. The plan for data analysis, then it is done by the descriptive and inferential analysis, and probability level was 0.05 was set for the level as a level of significance. Then ethical issues were the pilot study and the main study was conducted after the purpose was explained to the mother orally. The assurance was given to the study subjects of their anonymity and the confidentiality of the data collected from them. There was no physical and psychological pain caused by the mother and toddlers. The data analysis and interpretation was done. Again, here the 6 section has been divided. In section 1, the data on background data of the mothers among toddlers with and without daycare. In section 2, the background data of the toddlers and toddlers with and without daycare of mothers. Third one, the growth of the toddlers with and without daycare of the mothers. Next one, the data on development among the toddlers with and without daycare of the mothers. In section 5, data on association between the growth of toddlers and the background data of the mothers and toddlers. And in section 6, data on association between the development of toddlers and background of the data of mothers and toddlers. So these are the characteristic of the participants which we have found. So majority of the toddlers with the daycare, we have found that 26, that is 57.8% of the toddlers were in the age group of 25 to 34 months. 22.2% had primary education of the mothers, primary education. Then here we can say then 66.7% belongs to the low poverty line, 57.8% belongs to nuclear family, 46.7% were available in the house except for work. Then 71.1% did not have help from the maternal grandmother, and 35.6% had good support from the mother-in-laws also. So without daycare, we can see here to around 62.2% were in the age group of 25 to 30. Again here, then here this is the maternal data. So 33.3% had the secondary education, 64.4% mothers belongs to the below poverty line, 51.1% belongs to joint family, 68.9% were available in the house except for work. Then 62.2% did not have any help from the maternal grandmother. 48.9% had good support from the mother-in-laws also. So this was the data has been found after the data collection. The characteristic of participants, majority of the toddlers with daycare, they were male, that is 55.6%. Then 37.7% were born in third and above. Then that is the sequence of born, okay, birth. Then 37.8% had 3 and above living children, 93.3% breastfed above 6 months. Then 68.9% started weaning between 4 to 6 months. 46.7% were lacto-ovo-vegetarian and 44.4% affected with the respiratory infections. Then with the daycare toddlers, 60% were male. Majority of that is 37.8% children were second born. 40% had 2 living children. Then majority of that is 82.2% breastfed more than 6 months. So still many of the children has not got the breastfed. Then 60.4% started weaning after between 4 to 6 months. Then here you can say to 48.9% were lacto-ovo-vegetarian, 42.2% affected with respiratory infections. The findings of the study were, first objective was to compare the growth among toddlers with and without daycare of the mothers. In that, the mean BMI of the toddlers without daycare of the mother was significantly higher than the toddlers with the daycare of the mothers. So there was no significant difference in the growth of the toddler with and without daycare of the mothers. The second objective was to compare the development among toddlers and without daycare of the mothers. So here the mean development of the toddlers without daycare of the mothers was slightly higher than the toddlers with the daycare of the mother. So there was no significant difference in the development of toddlers with and without daycare of the mothers, as the t value t is 1.732 and p was more than 0.05. The third objective state that to associate the growth and development of toddlers with selected background data of mothers and toddlers. So here there was significant association between the growth of the toddlers and food habits of the toddlers without daycare of mothers. So here p value was 0.035. So it was significant. So there was significant association between the food habits of mother with the toddlers with the daycare of mothers also. So majority of the toddlers with and without daycare of the mothers reported to eat lacto vegetarian of the food, that is 46.7% and 48.9% respectively. So the results talks about there was no association between the growth of the toddler with daycare and without daycare, and the mother's factors such as age, education, socioeconomic status, and family history, availability of mothers or quality of maternal grandmothers, help, and quality of mothers and the quality of mother-in-laws. So that was P was more than 0.5. So another says about the another association talks about there was no significant association between the growth of the toddlers with and without daycare of the mothers and selected factors such as age, such as sex of the child. This is regarding the toddlers, and birth order of the child, number of living child, birth weight, duration of the breastfeeding, time of weaning started, and illness of the child within a month. So there was no significant association between the development of the toddler with and without daycare of the mothers. The mother and maternal factors such as age, education, socioeconomic type of family, availability of father, quality of maternal grandmother's help, quality of life, quality of maternal mother-in-law's help also. So same here. So the implication of this study talks about this we can do in nursing service, like food habits was significantly associated with the growth and development of toddlers with and without daycare of the mothers. Therefore, the nurses should pay attention to the type of food and the promote the growth and development of the toddler. The lacto-vegetarian significantly contribute to the toddler to the growth and development of toddlers. Therefore, appropriate education training may be given to the mothers and the caregivers. The limitation of this study was the sample was selected by using non-random method. The verbal responses of the mother regarding their presence and absence during the child growth could be verified further. It was beyond the control of the investigator, so we could not. So the expressed economic status was not verified at beyond the control of the investigator. The sample taken only was 90, and which was inadequate for the descriptive study. So we could have done more, as the time was not that much feasible. So we was stick on to the 90 sample. The recommendations are the growth and development of the under 5 with and without daycare of the mothers can be studied. Similar study can be undertaken with large number of samples. The comparative study can be done in the urban and rural areas. Let me conclude my topic. The lacto-vegetarian significantly contribute to the growth and development of toddlers, irrespective to the daycare of the mothers. So therefore, all the children must be given lacto-vegetarian diet. When if suppose there is no cultural constraints, there is an affordable meal. So this is an affordable meal which we can give. Mothers with mother during the pregnancy, lactation, and childbearing must be educated regarding the lacto-vegetarian diet. See, lacto-vegetarian diet is nothing. Lactose, that means milk, whatever the diet contains with the milk, and ova related to eggs, okay, which has non-muscle chickens and all. So here this kind of diet can be, we can give during the health education. We can tell the mothers this has the contribution to the growth and development of the baby. So thank you all. If anyone has any question, they can ask, please.
Thank you, ma'am. Thank you, Bhuvaneshwar ma'am, for excellent and thought-provoking presentation. Your research highlights important findings that will positively influence both academic and clinical practice. We appreciate the depth of analysis of clarity with which we presented your work. Thank you, ma'am.
Thank you so much, sir. Thank you, sir.
Khanna ma'am, anything you wanted to add?
Thank you, ma'am.
Yeah, just wonderful presentations, and we are sorry that you're missing your feedback resource person because she was not doing a letter say go.
It's
So
okay,
she has
ma'am.
gone. But since I'm also a pediatric certified nurse, so it was to my interest also, and especially the toddlers when they have temper tantrums and all, and you manage them very well.
Yes.
Great.
Thank you, ma'am. Thank you so much, ma'am.
Okay, moving on.
Yes, ma'am. Thank you, ma'am. Now I take this opportunity to introduce our guest of honor, second resource person, today's moderator, and our NSS Joint Secretary, International Liaison Officer, Chapter President, International Chapter, Carnation Chapter, Dr. Asya Qureshi, ma'am. Dr. Asha Kurishma is well-known nursing leader, seasoned publisher, and expert researcher. Asha Kurishma have been associated with the Galgoti University since 2014 to 2021 after entering 45 years of services at AIIMS. She has a credit professional experience of over 50 years, completed her PhD in public health. She is also MBA from Modern Institute of Management, Newport University. She joined AIIMS in the year of 1970, retired after superannuation in the year of 2014. October, worked at various capacities as PHN with WHO project, clinical nurse, educator, administrator, researcher at AIIMS. Her area of interest includes community health nursing, nursing education, nursing administration. She has her credit more 30 research publication in national and international journals awards. She has been awarded with the Mahila Sharam National Award from President of India in 1995 for the best community and patient care services. And Rajiv Gandhi Excellence Award from NRI Society of India, Delhi Health Minister for the best community volunteer service. With her absence, Khanna ma'am, anything you wanted to give a message on behalf of Asha ma'am?
No, we will do the next project
Yes, ma'am.
because we are already running out of
Yes, ma'am.
time.
Now I request Professor Mr. Neeru Patel ma'am to give her introduction and about her speech. Over to you, ma'am.
Yes, sir. Yes, sir. Thank you, sir.
Wonderful.
My slide is visible, sir.
Yes,
Yes,
ma'am.
but you
Yes.
give your introduction first.
Yes, ma'am. Good morning to one and all present here. Respected patron ma'am, Dr. Khanna ma'am, our chief guest of this event, this webinar, and our National President, Dr. Binu sir, and my mentor and guide, Dr. Raman Kalia ma'am. Good morning to everyone again. And I'm really thankful to Shu Khanna ma'am to give me this opportunity to talk on this national platform and giving the very interesting topic and current topic to talk on AI and clinical nursing. Brief about my journey in the nursing. I have worked as in different role in nursing, like in a clinical, in the administration and teaching. As an academician at present, I am the chairman for the RRC committee, Research Review Committee in V. Narmad South Gujarat University, and even holding the post of chairman in the examination, board of examination also in our university and other universities also. I was very lucky to participate in this revision of the GNM syllabus in 2003, and I'm guide for master students in our university and other universities also, and actively participating in research. And even presently I'm working since 8 years. I'm working as a principal in one central government institution situated in the Dadra and Nagar Haveli near to Gujarat. So I'm going to start, and the following heads are given for today's session. The first, I'll be talking on the introduction, that is AI, where we are in aspects of AI in India, AI and healthcare, AI and nursing practices, advances, and future scope. So very glad to inform you that tomorrow onwards, one important summit is going to start in India, with the aligned with the vision of Viksit Bharat 2047 at the Bharat Mandapam, New Delhi. So here it will be chaired by our respected PM sir, and here 100 countries are going to join and going to talk about the AI and its future in India and other countries. Maybe we are expecting that we are going to have many MOUs and development. Even the Bill Gates, Ambani, and many special guests. If you will visit the site, you will get that very eminent personalities are coming to develop our future on AI in India, I think so. So we also were a little fortunate to have a pre-con of this summit in our government, in one government engineering college of our Dadra and Nagar Haveli. So it is really, if someone is getting a chance to join it, it will be a really holistic area where people will develop the future of AI in India and other countries. Here they are going to talk on 3 pillars mainly. This all summit is based on the 3 pillars: people, planet, and progress. As it is a part of holistic development. People means here mainly they are going to concentrate about the people's health, how AI will work for the health sector and improving the quality of life. The another pillar they have selected, that is planet. So they are going to talk about the how the globally will sustain the environment, our climatic changes. They can check the climatic changes and how the resources will be managed. And third pillar of this summit will be the progress. So yes, it will be a very good platform, innovative platform, I can say, in India, for India, and it will definitely will give a good growth to economic growth, innovation, and technological advances of our Indian, in our India also. Yeah, if we'll talk about the another session, that is another that how it is helping for the healthcare. Here we can see telemedicine, electronic health records. These are the way we can even get data of the patient, even though they are far from our place. Even recently, you all may be heard about the Kokilaben Hospital, Kokilaben Dhirubhai Ambani Hospital. We have a MOU with them, and they have done one surgery that is called Shanghai to Mumbai. The surgeon was sitting in one office at Mumbai, and the surgery was taken place in the Shanghai, and 550-gram prostate they have removed through robotic Tomai system they have used for it. That's really a good innovation in the healthcare sector, and India also it is coming and developing. Now we'll talk about if healthcare sector is influenced. Definitely, nursing also is going to influence with that. Exploring how artificial intelligence is revolutionizing nursing practices, enhancing patient outcome, and empowering healthcare professionals to deliver the exceptional care in the digital era. Nurses also having in nursing also there are many role of AIs like clinical decision support. Yes, this is a different kind of device or tool which will help the nurses to promptly take their clinical decision and give the quality care. I'll give some example here. In some California hospitals are using some this clinical decision support system that is called CATI and Rothman Index. CATI, it's a triad system in the emergency department where you can promptly decide the treatment of the patient, and similarly Rothman Index also it's a AI algorithm detect the patient's health condition in the real time using data from electronic health resources, and based on this data the nurses can analyze, interpret, and take decision immediately. As our chief guest madam also told that we have lots of data, and after seeing that kind of data we have more confusion, but AI guided clinical decision will resolve this conflict in a better way, so we can take the better decision in nursing. So here they have shown that mortality has reduced. 16% mortality rate has reduced after using after using this both tools, decision making tools. So that is a great boon for the nursing practice to have this kind of clinical support system or tool available, especially for the nursing. Yes, as we told that data analysis and anticipating the patient needs is sometimes difficult for us. So this AI will help us in all these aspects for analyzing and predicting the data for the patient care. This proactive approach of using the AI transform the nursing from reactive crisis management to preventive healthcare excellence. Yes, I believe it. Surely, if we are joining with the AI nursing will do better in the for the society. How it is helping the nursing in a day-to-day practices. If we'll talk about the first is automated documentation. Yes, if you will talk 10 nurses, 9 will say we are burdened with writing work. So documenting in the hospital with this AI generated tool, it will be very easy for the nurses to document in a faster way and record and store in a proper manner. Another one is smart medication management. Yes, intelligent system handle the medication administration, tracking and inventory control. That is going to be so we can reduce the medication errors, many medication errors from the nursing. Then seamless scheduling. Yes, we have many patient burden nowadays. So as you're working as a nurse practitioner, you will be having this kind of burden. So that also can be reduced. And furthermore, it is enhancing the patient focus. Yes, you can give, if AI is reducing your task, definitely you can give more time for for your patient nursing care. See, using the AI, it's not a that you are not going for the patient. You have to go at the site of the patient. That time is going to increase definitely. If we are using, you can just this in this pictorial form. You can see traditional way of diagnosis, and here you can see the advanced way of or AI based diagnostic, and this is entered now in all area, even this diagnostic area also even not left here. X-ray, CT, MRI will be, we are waiting for the radiologist to give the interpretation and all. That can be very very immediately it can be done if we are taking the help of AI in diagnostic care. Now, yes, if we are having the advantage, definitely there are some challenges also. So we are navigating the ethical landscape with the
Jennifer,
use
ma'am,
of
please
AI.
mute it, please.
One is understanding limitation. Yes, nurses, if you will find the research or survey, it will show that nurses are very optimistic for using the AI in nursing practice. They are not hesitating, but in some cases resistance also existing. So first the nurses must get the understanding of AI use and its limitation. Yes, we must understand that using AI is augmenting. This is a tool that augment, not replace clinical judgment and human expertise. Human touch is required in nursing. I can say AI use will enhance the human touch, because you will get enough time. Now at present you are not getting enough time to talk with patient, but after using AI your workload will reduce, so you can get in touch with your patient more. Another one is addressing biases. Clinical awareness of algorithmic biases is essential. AI trained on incomplete database may cause some errors in the diagnostic and even the management skill. So data must be correct. That also very essential. That problems also can persist. Then maintaining autonomy. Yes, here I like to say that even though it is a many system supportive system through AI. It is helping, but overall responsibility going to be lying on doctor and nurses. So keep decision making with you, not with the AI. AI will give you interpretation, but decision making and answerability, responsibility keep within you. Then only it is possible to use a comprehensive use of AI in nursing practice. Another is protecting privacy. Yes, here many nurses are shown the this one regarding the question regarding the trust on the data. So that can be ensured before using any kind of AI, that you must be trusting the AI data. And because here one more chance is to leakage, and there will be privacy issues when we are dealing with more data. So that is going to be a one challenge. So these are we have some limitation, but I think so advantage are more in clinical nursing than compared to this kind of biases or errors. I have discussed only four here, like understanding and limitation, and addressing biases, maintaining autonomy, and protecting the privacy. So very limited control is there. So I think so nurses also can actively go with this area. Finally, I like to sum up this session with a saying that artificial intelligence is not just a technology. It is a tool for transformation, equity, and empowerment. Together, we will build an India where innovation serves humanity. A nurse's ability to use to AI will be greatly enhanced if AI learning and instructions are incorporated into nursing curriculum. There is a need to add the AI in the nursing curriculum. That can be our leaders can think over it. And finally, I can say redefining nursing practices for an AI-driven future. Thank you so much for giving me this chance. Here are the references.
Thank you, Neera ma'am, for your insightful and thoughtful provoking presentation on artificial intelligence in education. Madam has clearly highlighted how AI is transforming teaching learning process from personalized education to research support, academic decision making. Thank you so much, ma'am. Kanna, anything you wanted to add?
No, it was so wonderful. I wish we can go on and on and on. But she gave us information about another on February 16th. So wonderful. We will be getting more information from you, Neeru.
Thank you, ma'am. Thank you. Yes.
Thank you, Neeru. Now I take this opportunity to introduce, to welcome our special guest, Professor Mr. Indra Moza ma'am, to introduce herself and give her blessings to this particular event. Over to you, ma'am.
Good morning to all of you.
Morning.
Am I audible?
Yes, ma'am. You're audible, ma'am. Please go ahead, ma'am.
So it gives me an immense pleasure to be with you, with the NSS family, and especially for inviting me in this webinar series of 13. I'm very thankful to Dr. Sukhana ma'am, Professor Emeritus and seed founder of NSS Patreon, and Dr. Binu Joy sir, and special guest, everybody, and Asha Kurashi madam, my teacher, Dr. Raman Kalia madam. So I'll give the brief profile of myself. I'm Dr. Indra Moza, Principal Acharya Shirchandra College of Nursing Education, Sidra, Jammu, J&K. I'm founder and former principal of College of Nursing, Gandhinagar, Gangia, Nodal Officer, Red Ribbon Club, Government AIDS Control Society, J&K, President, NSS Gladia Chapter 16, My publications, national member board of studies for all the nursing programs in University of Jammu, member selection committee for recruitment of teaching faculty in nursing colleges in Jammu.
Patri Sevi Rambabu, please mute yourself. Please
I have been awarded by two health ministers of government of J&K for contribution in prevention of HIV/AIDS and appreciation certification by project directors, Government of J&K AIDS Control Society. Recently in 2025, awarded by the Secretary, Health and Medical Education Department, Government of J&K for organizing program to for prevention of for the youth for prevention of AIDS and drug de-addiction. Saved the lives of 2 patients by performing BLS during COVID. Felicitated as President Gratitude Honor Award by National NSS Florence Nightingale Birthday Award on 12th of May 2022 by National NSS. Felicitated on International Women's Day as Women of Wonders. Awarded as resource person in MDP for nurses organized by Academy of Hospital Administration AHA in collaboration with ESCOMS and hospital, lifetime member of TNAI, NSS, SNA, and institutional advisor. So we'll start with the topic artificial intelligence in nursing education. So please slides. Am I audible?
Yes, ma'am. You're audible, ma'am.
My slides.
Just a minute, ma'am. I think this one, no, ma'am?
Yeah. These are my
Yes, ma'am.
artificial intelligence and nursing education. So everybody has talked about this artificial intelligence. This is the blessing in disguise for the nursing profession. In fact, for everybody, but this has made us very much accurate and effective learning, which is given by this artificial intelligence. A computer system designed to perform tasks required the human intelligence. That means to perform the complex tasks using the applications are like chatbots and diagnostic tools capable of mimicking human cognitive functions in learning and decision making. And that means AI mimic the human capabilities, that is resourcing, problem solving, and creativity. Artificial intelligence is increasingly integrated into nursing education and healthcare system, enhancing both theoretical as well as in clinical practices. Next slide.
Yes, ma'am.
A transformative force equipping the future of the nurses for with essential digital literacy. Artificial intelligence is revolutionizing the nursing education. As far as the students are concerned, it is very effective. It gives us the effective means by motivating for moving from traditional methods to dynamic, that is database learning. Means previously we used to prepare our topics by means of writing or taking so much of time, but this has these things has been very much simplified by this artificial intelligence. AI supports training by providing the personalized learning, skill development, and innovative educational tools. Means we are learning day by day, we are learning the new techniques and tools for our future practices. AI empower the future nurses with modern technology, that means safeguard clinical skills, AI tools like virtual patients and decision making improve the critical thinking, data analysis, and clinical judgment. That means next is bridging theory and clinical practice to prevent the errors. What the errors we used to do in our practice, day-to-day practice. So those errors we are keeping in mind, and it gives the correct means for our services. Simulated IC scenarios to check the critical patients, improving the professional efficiency, reduce the documentation time, freeing the nurses for direct patient care through automation and predictive insights. Then artificial intelligence in nursing is blessing in disguise, what I said. The ethical humanistic aspects, then profession is rooted in empathy. That means to deliver and to manage the skill programs for growth, for the number of teaching and learning spaces, teaching and learning basis. So human, it is regarded as the human connection through qualities cannot be replaced, viewed as a sportive tool but not substitute. Then faculty development programs, what we used to do day to day. AI effective training is prepared for the nurse educators, which keeps the inclined to everybody and to every student to be connected with such programs. AI as a partner acts as a versatile partner, that means for 24 hours, for 7 days, enhances the productivity, innovation, and emotional support, and 3D provision in clinical settings for complex procedures, risk-free emergencies, and skill retention. Then what can be the benefits for the students in future practices? Safe practice means there is no harm for any patient. If we used to do any practice upon the patient without any harm, we can build the confidence to do any such procedure. Enhancing the critical thinking. So it provides the knowledge and develops independent think and problem solving techniques in the complex scenarios. Then improved clinical skills in nursing education. Hone technical skills, that means the technical skills which are hand to hand. Means by these things we can learn IV infusions like catheterization, which cannot harm to any patient, and interpersonal communications. Accessibility. Cloud-based platforms allow a remote collaboration and scalable trainings. That means by means of in our hospital also, in our lab, there is a cloud anatomy lab. So it provides us the specification of, for example, we are going through the learning practices by for the patients, and it gives, for example, AP and anterior posterior portion of the bone, lateral portion of the bone. In fact, minute and micro things we can see through that anatomical lab. So conclusion is, artificial intelligence encompasses the applications, benefits, and challenges focused on equipping the nursing as well as the nursing students with essential skills to improve the educational outcome and healthcare quality. Thank you.
Really, it was such a
Thank you, ma'am.
great,
Thank you so much
great
for insights.
presentation. Indraji, thank you. Thank you very much.
Thanks a lot. You have given me this opportunity to be with you, to the family.
Thank you, ma'am. Thank you. Now I take this opportunity to go with the announcement of newly joined members. For that, I want to call Khanna ma'am.
Okay, we start with quickly the new members list. It is a very short one,
Yes, ma'am.
but we want to recognize and say the prayer that our whatever we are going to do with the pledge. So the name is Shaira Hetal Ben Madhubhai. She is a student and our general member. Mansuraj Asma Banu, and it is a general RN, our member. The third one is Shabnam Ara. She is a presidential member, and we wanted to induct her in Hall of Fame, but she is not here. Maybe she did not get our message on time, so we will do next time. And she will be our executive member with Sama Jilani ji in Jammu and Kashmir's Tulip chapter, number 7. Okay, so we will move on to vote of thanks.
Okay, ma'am. Thank you. Over to you only, ma'am. Vote of thanks.
Okay, would you like to say it? Because I'm just having.
Yes, yes, ma'am. Yes, ma'am. It's
Please.
on behalf of Khanna ma'am, just I'll continue as a vote of thanks. It's always hard to say goodbye when we all want to enjoy others' company to the longest possible time, but reality is different. We need to get back to our committed responsibilities. My sincere thanks to our chief guest, resource person, guest of honor, special guest, NSS president, organizing team, presenter, audience, and our lovely students. Last but not least, our both masters of ceremony, myself, Dr. Muthu, developing a colorful PPT. Thank you all. Best wishes and God blessing you. Thank you. Thank you so much. Ma'am, you are muted. Ma'am, you are muted. Unmute yourself, ma'am. Thank you, all of you. Ma'am, you are muted.
Thank you from our side
Thank
also.
you.
It was
Thank you
nice
so
to
much,
listen
ma'am.
to all the presentations. It was
Yes.
nice to listen to all the
It was nice
presentations.
to
They did
all
it very well.
AI and
And
nursing.
Yes, ma'am.
yes,
Thank you, Rita ma'am,
I can
Swati
see.
ma'am.
Thank you, ma'am.
Rita
Thank
ma'am,
you, sir.
Anna
Thank
ma'am,
you, ma'am.
sir.
It was actually the reminder
AI
to
nursing.
us that we cannot get away from AI implementation,
Yes,
Correct.
whether it is
yes,
education or clinical or
Yes.
research. And the nurses have to be abreast with all the knowledge if we are in the mainstream with the other professions. So you guys did such a good job and that alerting us what is actually in practice you people are doing with the research, with the education, and with the clinical. And thank you, Swati ji. You did
Thank
such
you,
a
ma'am.
great.
Thank you, Nirmala ma'am. Thank you.
Rita ji just
Thank you,
had
Rita ma'am.
a cream of it.
Yeah.
Wonderful,
Thank you.
wonderful.
Thank
Thank you. Thank you.
Thank you so much, ma'am. Thank you.
Thank you, madam. Thanks, everyone.
Thank
It
you,
was
everyone,
nice to
for
be
Thank
joining
here.
you.
with us.
Thank you, Muthu.
Okay,
Yes,
then
ma'am.
Dinu
bye
sir,
bye,
if you
everybody.
want to say anything.
Okay.
Dinu
Uh-huh.
sir.
Dinu sir, anything you wanted to add? I think, sir. I think sir is not there, ma'am.
Okay, so formally, if you want to wind it up and say bye.
Thank you all of you for joining with us. Next,
Thank
I
you,
think
sir.
coming up again, next week we
Did
have.
you take one picture of all of us?
No, I didn't take, ma'am. Actually, I think everybody left, ma'am.
Take one picture. Who
Just a
all are
minute.
here?
I'll take. Yes, ma'am. I'll share with you, ma'am.
Okay, thank you and good night
Thank
to
you,
each.
ma'am. Thank you.
Thank you, ma'am.
Good night.
March 8. March 8 is another our event.
Yes, ma'am. Yes, ma'am. We'll go ahead with that thing also, ma'am.
Yes.
Thank you, everyone. Have a nice
Thank
day.
you. Thank you, ma'am. Thank you.
Have a nice day. Thank you, Indra ma'am, Raman ma'am, and Neeru
Thank
ma'am.
you, thank you, thank you, sir.
Thank you, ma'am.
Thank you, sir. Thank you, sir.
Swati ma'am, bye. Bhubaneswar ma'am.
Thank you, sir. Thank you so much, sir.
Dilani
Thank
ma'am.
you. They are sending us some of the messages. Thank you to each one